Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
And we welcome to the program Lee Acey and the folks from the Help Care Clinic. Dr. Dave Strobel, I believe, might be with us as well. Good morning.
He is this morning. I was not sure I could be, but I'm going to be.
Through the magic of technology, maybe. But very good to have both of you here, and kind of a cool discussion today because you just keep ramping up the ability of us to share and get information about the Help Care Clinic.
Yeah, I mean, as we were thinking about it, one way that people can find out what we're all about is to go to our website and listen to the last dozen archived versions of our radio show. Or in a more concise way, we thought it'd be great to have a booklet that would, in a very concise way, lay out kind of the story of Healthcare Clinic, how it's different from the traditional healthcare system, how it can save you money, some of the things that are included and covered. And this is actually something that we developed for use in the upcoming workshops that we're going to be having starting a week from tonight, and then the following 2 Thursdays at the Hormel Historic Home. We'll be using this as one of the resources for folks who are thinking about open enrollment, thinking about their insurance for next year. But we think this is, we're really kind of proud of what we put together here as something that really based on, hundreds of conversations we've had with people who've had interest in this to say, how do we just really boil it down in an 18-page booklet that tells the story.
And giving it a quick glance this morning, you were nice enough to share a link with me this morning, and I know you're going to do some more tweaks to it, but it really, to me, is done in layman's way that I can understand it, and I'm not a medical guy. It's straightforward information.
Yeah, it's important to do that because people get boggled when you give them information that's all technical and everything. You have to break things down so that they understand it, and that's what I do from a medical standpoint. I use analogies and all that kind of thing to describe physiology and stuff. But Lee's really good at that too with a lot of the financial stuff, and so he's been the driver for this new booklet, and I just think the thing is just brilliant.
And from what I was reading this morning and the information that Lee was nice enough to send, this will primarily be available as an online tool, or are you also going to get some copies printed so people can get a hard copy?
Oh, yeah. Yeah, we're definitely going to have copies printed, and we'll be distributing those at those workshops that we're having. But it's intended for people who want to get it pretty immediately, that they'll be able to download it, read it on their computer, and they'll have links that they can click through to see some of the information as well. But yeah, we're going to have it printed, and it also will be developing some worksheets for people that when they come to our open enrollment workshop, starting next Thursday and then the following 2 Thursdays, I mean, they'll all be the same, so they don't need to come to all 3, but they come to one of them. We'll have some worksheets for them to evaluate their current insurance choices and to say one deductible versus another, and how does this fit in with it, and what would that mean for their bottom line, but help them to just really sort it out, because as you said, healthcare financing can be really confusing, and what we're trying to do is, in addition to simplifying the healthcare experience through Healthcare Clinic, we're trying to simplify the experience, but also reduce the costs for folks who are needing to get care.
One of the things I've never understood about this sign-in period is how year to year, no matter what your plan is, it seems there are things that can change, and it's in that minutia of this prescription was covered, now it's not, or now I'm paying half of it, before I paid none of it. And it's important to really pay attention to that each year, and that's why you're holding the workshops, to help people kind of sort through at least the choices that they have when it comes to their insurance and how they handle their health care.
Right, and as we addressed in one of the chapters, and we kind of talked a little bit about last week, when insurance covers so much of the day-to-day stuff, then that just adds a whole lot of administration, and that's why they put in the changes in the co-pays and all that. Whereas if you can, have the membership approach that we're using, you have a very predictable cost for most of your basic care, and then you just have to say, okay, now what kind of deductible can I live with financially that's going to, if something really bad does happen, what kind of deductible do I need that will, keep me whole, with that catastrophic coverage. And it's, as I said, healthcare doesn't have to be as expensive as it is. It also doesn't have to be as complicated as it is, and that's part of what we're trying to do through this.
Absolutely, and then maybe we talk a little bit more about those seminars, because it is going to be. I know sometimes you hear about these things, you think they're going to be intimidating. You intend this really to be almost a conversation that people can really dig down into what they need to know about their sign-ups and what they're going to do, and you want them to just get as much straight-out information as possible.
Yeah, it'll be very much conversation. We'll have some information that we'll present. We'll have this booklet as one of the things that we hand out, but we'll also then ask them, bring your open enrollment documents, and we can kind of look at them together and see what your options are. And then also, if you have copies of some previous bills, so that you know what you've been paying for some of these things out of pocket previously, that's an important thing to take into account as well, because through healthcare clinic membership, a lot of those things that you traditionally are paying for out of pocket are included in the membership, and so there's no extra charge for them.
We should probably, before we run out of time, just remind people, when are these sessions that you're going to be holding? Where are they? And how do we need to sign up in advance or just show up? How does it all work?
Yeah, so just so we can plan, we appreciate people signing up in advance, and so they can give us a call at Healthcare Clinic at 279-2345. These sessions will be starting Thursday, a week from tonight, October 27th at 7 p.m. They're at the Hormel Historic Home, and so it'll be October 27th and then November 3rd and November 10th. And so please do. The other place that they can do is go online. We've got a sticky post on the front of the page. It says Preparing for Open Enrollment. If you click on that link, there's an online form where they can just sign up for whichever of the sessions they'd like to attend. They can register themselves. They can register a spouse. They can register a friend. So they can register more people as needed. And we'd love to be able to help out. And just in order for us to print up the right number of booklets and everything, just having people, and we're also planning some snacks, some low-carb snacks. We should be planning on if people letting us know in advance would be super helpful.
Yeah, we chuckle about you saying low-carb snacks, but I've been down there and visited with you, and I was amazed that even when it came to be snack time, you guys are really into healthy eating and making sure we're having, you can still have your snacks, but let's be healthy about it. So that's kind of cool.
Yeah, that's part of our secret sauce, I guess. We're going for the Norman Rockwell meets the Jetsons kind of vibe, and that's part of the Norman Rockwell thing, is that having friendly staff who are giving you snacks and coffee when you come in for your appointments. Yeah. Unless you're fasting for a blood test, then in which case you got to wait to have your snack after your blood test.
But it's good to know you not only do you talk the talk, you walk the walk too. I mean, everybody needs to really pay attention and take control of your health care. And that's really at the core of what you're trying to accomplish here, is allow people a different way to approach and get the information they feel comfortable sharing in a much more relaxed atmosphere.
Yeah, it's fun to do that. Go walking down the hall and saying, "Well, let me go get you something," and you give them something that Lisa has made, and they think, "Wow, that's really good." And it's like, okay, see, you can do a good diet and not be miserable. I use that all the time in education. So it's off the topic for today, but it's an important idea.
So the access to the booklet will be available soon, but really best thing to do would be to sign up for some of these information sessions and come talk to you about it, look at the booklet, and get more information.
If they go to the website, the top two posts that we have, one is Saving Through Membership. That's the title of the booklet. And so we'd encourage people to sign up and preview it themselves, because the more they can read through a little bit in advance, the better prepared they'll be. They don't have to study for it. I mean, if they come and they haven't read it, that's fine. But then, otherwise click the Preparing for Open Enrollment link and go sign up for the session that works for you. We'd love to have that conversation with folks.
All right, very good. We got just a couple of quick moments left. So again, let's remind people phone numbers, websites, location, where they can find out more.
Sure, they can call us at 507-279-2345. Visit us on the web at healthcare.health, or we'd love to have them stop by and see us, 308 4th Avenue Northwest, Austin, just between the Hormel Historic Home and St. Augustine's. Just one quick announcement. We are closed tomorrow and Saturday. Dr. Strobel's going to be out of town and taking a well-deserved family getaway. But we'll be back to see folks again on Monday.
All right, very good. I'm sure people make a note of that. Enjoy the time off, and we appreciate our conversations each Thursday, so we'll get together again next week. Gentlemen, we appreciate it. We'll talk to you next weekend.
Okay.
Thanks, John.
All right, thank you.
Have a blessed day.
Thank you. Bye-bye.
Take care.